Okay, now so let's go to the second half of the discussion for obstetrics. Now let's go to the postpartum naman. Okay, so this is after the labor and delivery. Okay, so there's a part in the Kessner wherein it covers the stages of labor. Okay, so please read that. We won't be covering that in the lecture here in Clean Ed. Okay, so do read that. That's just a very, very small part of the chapter of obstetrics. Okay. So as an outline, no. So we'll have this is kind of a shorter discussion, okay, of obstetrics. For postpartum, we have only 3 parts. We have the cesarean and vaginal birth recovery, your postpartum exercise design, and lastly would be the managing common postpartum issues. No, ito kasi yung mga usually these are the common issues wherein they get to be referred to PTs. Okay, so let's cover the cesarean and vaginal birth recovery first. No? So after the labor and delivery, okay, your cesarean birth recovery muna. Okay, cesarean birth recovery. So this is a major abdominal surgery, and unlike your normal delivery, it takes longer, no, for you to recover. So you have 4 to 8 plus weeks recovery period. Okay, so sometimes it depends pa, no, kung magkakaroon ng complication yung surgical incision. Okay, so peanut incision with movement. Okay, especially if you are carrying the baby, so mas medyo masakit siya, wherein if you have certain acquaintances, no, na nagpa-cesarean, 'di ba, wherein parang feeling nila bubuka yung incision. Okay, so hindi naman talaga as in bukang-buka, right? So it's just that the incision is painful with movement, especially with carrying heavy materials or carrying a heavy baby. Coughing or deep breathing as well. Okay, so cesarean birth recovery, no, there's a difficulty with baby care kasi nga hindi mo nga siya ganon mabuhat frequently, no, medyo bawal pa during the recovery period. Also, since meron kang meron kang incision, no, you have weakness and poor abdominal muscle tone. Okay, so this is one of the muscles that we would want to strengthen later on, no, after nang mag-heal nung surgical incision. Okay, so cesarean exercise goals, no, if nagpa-cesarean si patient, no, is definitely to improve abdominal muscle tone, increase circulation in the area, increase muscular strength, and speed recovery rate. Okay, so for post-surgery exercises, no, exercises should be started as soon as possible after the surgery. Pero hindi ito yung high-intensity kind of exercises, no? So, as simple as coughing every 10 minutes after surgery, yun lang muna. Okay? Practice saying the word hot, loud, and fast 5 times an hour. So, try nyo din, no? Hot, 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 hot. Okay? 5 times an hour yon, no? So, for post-surgery, yan muna yung gagawin ni patient. Okay? So, as early as after the surgery, pwede na nilang gawin to. Okay? And then, perform isometric abdominal contractions 10 times an hour naman. So, bale, you have at least 3, no? 3 tasks for the patient, no? Cough every 10 minutes after the surgery, the hot task, and then isometric abdominal contractions 10 times an hour. So, paano yung gagawin yun, no? So, you just expand the belly outward as you inhale. So, inhale. Tapos, mag-expand dapat yung belly outward. Okay? And on the exhale, once na nag-exhale na si patient, okay, you try to contract the belly inward. Okay? And hold that for a count of 5. Okay? So, meron siyang hold, no? Na 5 seconds. If ever, no, medyo masakit sa patient, kasi nga sabi natin kanina sa previous slide, di ba? Saan na yan? Ayan. There is a pain at incision with coughing. So, since we recommend, no, yung task na yon as soon as possible after the surgery, what you can do is place a pillow against the abdomen to help support the belly during all of these exercises. Okay. You can also perform pelvic clock exercise. Alright? Yan. So, with your pelvic clock exercise, this is also known as your Kegels exercise. So, in supine position with the knees bent, alright? Imagine that the belly is a clock face like this. Okay? So, kunwari, yan yung belly nyo. And then, to practice pulling the belly in at 12. Okay, 12 o'clock. Hip down at 3 o'clock. Okay. Sacrum down at 6 o'clock. And then, opposite hip down, 9 o'clock. Okay. So, ayan siya. Okay, so work a full circle. Okay, each direction and then rock back and forth, no? Up and down, no? Up and down, and then side to side. And then just repeat this 2 to 3 times every hour, no? For this, no, hindi siya kanina 'di ba, sa cesarean, very important yung 3 tasks, okay? Yung pelvic clock exercise, recommended din naman siya to cesarean, but not as much as to those who had normal delivery. Okay. Next, no? So, after a certain period, no? If medyo gumagaling na yung incision, wherein meron na siyang scar, yung black to brownish kind of scar, no? So, pwede na kayong mag-scar mob. No, pero pagka fresh pa, hindi pa kailangan gawin tong scar mob. Okay? So, this may be used on any scar that is healed. You just have to massage the scar with fingers using light and gentle pressure, no? Light and gentle pressure lang, hindi didiinan agad. Okay? So, i-gauge nyo din naman yon kapag meron na kayong patient. Okay, so you massage by rolling horizontally along the scar, no? Horizontally. Okay, because as seen here, no, yung medyo background nung slide, incision. Okay, this is the incision. So you massage by rolling horizontally along the scar. Okay, and then you can also do vertically against the scar. So, pag gagawin nyo to, syempre, you would apply lotion first, no? Para medyo moisturized siya. Mas madaling ma-mobilize yung scar. Okay? So, ang gusto mo kasi dito is somehow, no, yung scar medyo matanggal-tanggal na because nag-heal na yung incision, okay? Nag-dry up na talaga yung surgical wound. And gusto mo na lang tanggalin yung namuong scar. Okay? So, after which, no, kung medyo natatanggal-tanggal na siya with your horizontal and vertical massage, you can do blocking, no? Block scar up between fingers and roll each direction. So, kumbaga, for example, no, kunwari ito yung belly, tapos merong incision here, no? So, parang, when you say block, no, medyo kukurot-kurotin mo siya. Okay? Pero, syempre, light and gentle lang. And with lotion, no? Para hindi siya masyadong ma-friction. Okay? And then, once na medyo natatanggal nyo na siya, right? Pag medyo natatanggal nyo na siya, you can roll each direction para medyo gently natatanggal na talaga yung scar. Okay? So, perform the technique several times each day for 5 minutes or more. Okay? After the removal of the scar, no, you can still do the scar mobilization para yung mga namumuong adhesions underneath the surgical incision, no, yung healed surgical incision, medyo mababreak nyo. Okay, so para hindi siya masyado magkaroon ng adhesions. Okay. Next. Okay. These are the vaginal birth problems. Now we have perineal discomfort and your lochia. Okay. Perineal discomfort and lochia, this is usually experienced, no, sa mga nag-normal delivery. Okay. With your perineal discomfort, this is when you elevate the hips with pillows. It has been said to aid the reduction of swelling, no? So si patient, pag matutulog siya, no, you would want to place pillows in between the legs, okay, para ma-reduce yung swelling. Okay? And then when using the toilet, press a cool, wet compress to the swollen area to provide support and ease discomfort. Okay? Also, practice pelvic floor exercises to aid recovery of the muscles. Yung binanggit natin kanina na pelvic clock exercise or Kegels exercise, alright, pwede nyo yun gawin. Although si Kegels kasi medyo mas kaiba yung ano niya, we call this, yung pag-hold. Okay, sa Kegels. Yung pelvic clock, yun yung starting point natin wherein you try to move up, down, and side to side. Doble. Okay, next, your lochia, no? Your lochia is consists of bloodshed. Okay, it consists of blood, okay, and shedding of uterine lining and mucus. Okay, so for normal delivery, okay, first week post-delivery, meron ka munang bright red plus clots. Okay? Bright red plus clots. Okay? After the first week, no, it should turn into pink or brown plus clots that is smaller. Okay? And less frequent, syempre. Okay? After the first week, again, pink or brown, tapos ang clots niya dapat smaller and less frequent. Okay. Now, the discharge should become yellow or white, okay, and diminish by several weeks, no? So, an increase, sabi, no, naka-note, no, an increase in vaginal bleeding, discharge, and or return to bright red color should be followed up with your healthcare provider. So, with this one, pag si patient, no, nabanggit niya sa inyo na from yellow or white ang discharge, naging red na naman agad, okay, then you would have to refer the patient back to her physician. Okay. Yeah. Okay. So, part of the postpartum recovery, no, lactation hormones are produced, okay, and nursing mothers will need an additional 500 kcal per day. Okay? So, additional 500 kcal per day. Alright? So, pagka nag-start na din siya ng mga postpartum exercises niya, medyo mas dadagdagan pa. More than 500 kcal per day dapat ang madagdag. Okay? Postpartum women may experience mood swings, depression, fatigue, musculoskeletal discomfort, and incontinence. No? Yung incontinence, ito yung most common problem, okay, ng mga women, okay, after delivery, especially yung normal delivery. Okay? Because of the weakness of the pelvic floor muscles. So, very important ang pelvic clock exercise natin. The physiological changes of pregnancy will slowly dissipate, no? Kasi syempre, wala na siyang pinapalaking infant or wala na siyang pinapalaking baby within her. The relaxin hormone may continue to affect the pelvic joints during this. And it will continue to do so for up to 6 weeks. Okay? 6 weeks. Alright? So, knowing that, no, ang relaxin hormone, meron pa rin siya up to 6 weeks. So, might as well, no, hindi mo na mag-engage si patient to certain activities that might increase the risk of certain dislocations, okay, or kaya naman certain musculoskeletal injuries, no, lalo na pagka ang mga parent na ito like athletes, no, so ayan, no, wag muna. So for up to 6 weeks yun. Okay, usually kasi yung iba, no, lalo na yung not only the athletes, no, pero yung mga mother na ayaw munang after delivery trabaho agad because they had no choice, medyo mag-iingat because usually sila yung nag-end up na nagkakaroon ng symphysis pubis dysfunction, okay, or joint dysfunctions, okay, especially sa pelvis area resulting to low back pain, okay, or joint pain, no, at the area. Okay, now we're going to discuss postpartum exercise design. No? So I'll cut from here, no? So this will be the part 1 of our discussion. Okay? So next na lang sa part 2 of the postpartum discussion.